Hi, it's a great day to talk rehab. I'm Dr. DeFabio, and today we're going to talk about the dead bug progression. You know, it's pretty funny. This is for Megan specifically. The other day I was talking to her about core stability and the importance of the dead bug exercise, and I realized, Mike, we don't have a dead bug series up. So that's why we're doing the dead bug progression today. So, of course, Mike, say hi to everybody.
Hey.
Why do we do the dead bug progression? Well, that's when we want to do exercises for the core in what's called flexion. So let's turn sideways for a second, Mike. So if you look at the lower back and through here, there should be a little bit of a curve, and that's good. A lot of the McGills exercises, the bracing, the bridging, the side planks, the front planks, all of those are to maintain neutral spine because that's a functional position of the spine. You see, your spine's like a spring, okay? It's got curves in it. And a spring goes up and down and it gives because it's got curves in it. But if the spring is made straight and it becomes a rod, there's no more compliance. That's why it's important to maintain the spinal curves, all right? So with the lower back, we want to maintain that for function. But sometimes what happens is the hip flexors get really tight and get what's called an anterior pelvic tilt, and it causes an increase in the curve. That's bad because now it jams up the back and it puts irritation on the joints and it causes a lot of tightness in the muscles here as well as in the front here. It's called Yanda's lower cross postural distortion. So what we need to do in these cases is we need to get you into flexion, okay? Other people that need to get into flexion are people who have stenosis, spinal canal stenosis, or if you have something called a spondylolisthesis, where the vertebrae slides forward. So that's what we want to talk about today. Postural correction of anterior pelvic tilt. So let's go face up. Let's bring your head up here. To start that, first, we just need to feet flat in the ground, hips and knees straight ahead. Just get the hands out of the way so we can see what's going on. You see what happens? His back arches when his hands go up. So put your arms down to your sides and the back flattens. So we want to start with the arms down. Anything that does this will have a tendency, watch my back, to do that. Even reaching up to a ceiling will have a tendency to arch your lower back. So that's why we need to have stability in that area. So just cross like here so people can see. First exercise is to push your back flat into the ground. I'll put my hand here and I can feel the pressure there, okay? And relax. Push your back flat into the ground. That's the first exercise in the flexion or dead bug progression. Who's big on this is Paul Hodge. So if you want to research that, he has a whole series of exercises on this. So the next step is to go into dead bug position where the arms are up. The legs are up and the arms are up, and you want to flex down and hold that in this position, okay? Research has shown you want to have about 40 pounds of pressure when you do this. While you're maintaining that, scoot one leg out. And then come on back. Making sure this stays flat and hard the whole time against the table. Then move the other leg, keeping the back flat the whole time. Come on up. If you move your leg this far and your back starts to arch and lift up, stop, you're done. You got to keep that back flat the whole time. When you can move the legs individually, then move the arm individually. Raise the arm up, keeping the pressure here the whole time. See, it wants to lift up. You got to keep it down. That's the key. Other hand. When you can do the legs individually and the arms individually, then you can do alternate arm and leg. Okay? Keeping the back flat the whole time, not letting it arch. This is called bracing or quadruped inflection. In this position, Pilates pelvic tuck, whatever you want to call it, all right? It's very good to get that anterior pelvis to shift posterior, to strengthen the core, and to get the person who's got that increased sway back more balanced and stable, all right? So there's your dead bug progression in flexion for core stability. Hey, thanks for watching. Please like and share these videos and let other people know they can empower themselves by doing the best exercises to get a nice, strong, and solid posture. Have a great day.